Well, good evening, everyone. Good evening. How's everybody doing? We're good? All right. It's such a great, beautiful day here on Rocky Top, and my name is Joe Mazer. I have the honor of serving as Dean of the College of Communication and Information here at the University of Tennessee, which, in addition to the School of Journalism and Media, which is part of the college, both of those units, the college and the school, have been home to the Hill Lecture Series for over 30 years. And we are super excited to continue that tradition here tonight and appreciate you all taking time out of your busy schedules and busy lives to come tonight to hear from our Hill lecturer this evening. On July 1st of this year, WUOT, which is the university's NPR affiliate, transitioned under the College of Communication and Information. And this transition leverages the expertise of the WUOT staff, the faculty and staff expertise in our college, and provides a rich content for listeners and more learning opportunities for our students. I want to express my gratitude to WUOT's new general manager, Jody Hamblett, and her dedicated team. Jody's in the back, right over there. Yes, please give her a round of applause. Thanks to their valuable contribution and the wonderful partnership between the college and the station, Jody and her team were able to assist us in securing our guest speaker, our lecturer for this evening, who we will introduce in a moment. A little bit about the Hill Lecture. Tonight marks the 30th year, the 30th lecture in the Alfred and Julia Hill Lecture Series on Science, Society, and Mass Media. The Hill Lecture was established in 1989 by Tom Hill, former publisher of the Oak Ridger, and Mary Frances Hill Holton, in honor and memory of their parents. Alfred and Julia Hill founded the Oak Ridger in 1949, 7 years after the government established Oak Ridge to house workers on the atomic bomb project. The Oak Ridger was the first successfully private-owned newspaper in the city, and it marked an important stage in the transition of Oak Ridge from federal operation to private ownership and self-government. In addition to endowing the Alfred and Julia Hill Lectures, Tom Hill and Mary Frances Hill Holton also provided an additional gift to the School of Journalism and Media in 1987. They were the principal benefactors to match the state of Tennessee contributions to establish the Julia G. and Alfred G. Hill Chair of Excellence, a professorship in science, technology, and medical writing in the Science Communication program here at the University of Tennessee. And we are so honored to have members of the Hill family. We're so honored to have members of the Hill family here with us tonight. Would you all please stand to be recognized? We appreciate the family's leadership and support of the Hill Lecture Series. Thank you all very much. I do want to take a moment to thank Dr. Mark Littman for his 30 years of outstanding leadership and dedication to the Hill Lecture. Dr. Littman is a professor in the School of Journalism and Media, and he currently holds the Hill Chair of Excellence in Science, Technology, and Medical Writing. Dr. Littman is a Chancellor's Professor, which is an honor reserved for only a fraction of all of the faculty on the University of Tennessee campus. And he is a CCI Board of Visitors Professor. Dr. Littman, thank you, thank you, thank you. And now to introduce our guest speaker for tonight. I'm honored to introduce Rob Stein, award-winning journalist, correspondent, and senior editor on NPR's Science Desk. I'd like to begin by extending my gratitude for Rob for dedicating his day, giving of his time to be here on Rocky Top and meeting with students and faculty in the College of Communication and Information. Today, he had very meaningful discussion with students in a course on science writing and medicine. He participated in an interview with the Daily Beacon's editor-in-chief, Abby Ann Ramsey, and met with undergraduate students to share valuable insights on the importance of science writing. His contributions have made a significant impact to our college in the brief time that he's been here, and we're so thankful for his time and expertise. So, Rob, thank you so much for inspiring the next generation of students today, and welcome to Rocky Top. Give him a round of applause, please. You can come on up, Rob. I'm gonna tell everyone a little bit more about you, so you could stand up here as we do that. Rob is an award-winning science journalist with more than 30 years of experience, mostly covering health and medicine. His stories focus on issues that illustrate the intersection of science, health, politics, social trends, ethics, and federal science policy. He tracks genetics, stem cells, cancer research, women's health issues, and other science, medical, and health policy issues and news. Before NPR, Rob worked at the Washington Post for 16 years, first as the newspaper's science editor, and then as a national health reporter. And earlier in his career, Rob spent about 4 years as an editor on NPR Science Desk, and before that was a science editor for United Press International, UPI, in Boston, and the science editor of the International Wire Service in Washington, D.C. Rob frequently represents NPR, speaking at universities, international meetings, and other venues, including the University of Cambridge in Britain, the World Conference of Science Journalists in South Korea, and the Aspen Institute in Washington, D.C. His work has been honored by many organizations: the National Academy of Sciences, the American Association for the Advancement of Science, the American Association for Cancer Research, and the Association of Healthcare Journalists. He was twice part of NPR teams that won Peabody Awards. Rob is a graduate of the University of Massachusetts Amherst. He completed a journalism fellowship at the Harvard School of Public Health, a program in science and religion at the University of Cambridge, and a summer science writers workshop at the Marine Biological Laboratory in Woods Hole, Massachusetts. So, ladies and gentlemen, please join me in welcoming to Rocky Top our 2023 Alfred and Julia Hill Lecturer, NPR's Rob Stein.
Thank you. Thank you. Nice to be here. Well, thank you very much for that generous introduction. I'm a little embarrassed hearing so much about myself. Hello, everybody. Thank you so much for coming out tonight. I really appreciate you taking the time. It's really an honor to be here. Am I echoing? Yeah, I am. So
let's see. I gotta turn myself down here.
Oh, you're gonna do it for me? I wasn't sure if that echoing was just in my head or in the room. Is that better? I'll keep talking. Yeah? Okay. I'm embarrassed to say this is my first time to Knoxville, and after spending the day here, I can't believe it took me so long to come here. It's really a charming city, and I definitely want to come back. So thank you for introducing me to your lovely city. It's really been fun just to get to know the city a little bit. It's a quick visit, but definitely hope to come back. And when I'm on the radio, part of my brain knows that I'm talking to thousands of people, but mostly it doesn't register. It's a little mental trick I think people do. I'm usually in a small studio by myself, or maybe with one or two other people talking into a microphone. So it's always kind of discombobulating, I have to say, to be actually here talking to real people. It's not something I used to, especially after the last 3 years when I've basically been broadcasting completely by myself in my attic in my house in Northwest DC. So if I seem like I'm out of my element and discombobulated, it's because I am. I find it intimidating to actually have real people looking back at me when I'm talking. So with that disclaimer, let me get to it. So the title of my talk tonight, as you know, is Covering Science in a Post-Pandemic World. It's, as you can see, it's kind of a broad title, and I have a confession to make. There's a good reason for that. I had to come up with the title before I really had time to sit down and think about what I was going to say, so I decided to come up with something that would basically give me a pretty open palette and a lot of room to move. And so when I finally sat down to think about it, the first thought that popped into my head was, the pandemic? I'm still talking about the pandemic? Does anybody still want to hear about the pandemic? I don't know. Does anybody in this room want to talk about the pandemic, think about the pandemic? No, nobody does, right? I don't. After these 3 miserable years, nobody wants to think about the pandemic or hear about the pandemic. But, I realized that when it comes to, science journalism and science communication, there's really no escaping it. There's still no way to talk about covering science without talking about the long, dark shadow that devastating event has cast over our field. It really was an historic event. According to the World Health Organization, there have been more than 770 million confirmed cases of COVID worldwide and nearly 7 million deaths. And, to be honest, to my embarrassment, my title kind of commits a cardinal sin of journalism, which is that it's wrong. We're not living in a post-pandemic world, right? The U.S. government and the World Health Organization have declared that the emergency phase of the pandemic is over, but the pandemic itself is not. COVID-19 continues to spread around the world. So even though we're all sick and tired of the pandemic, it's still, unfortunately, a big problem in lots of ways. First of all, it's still making lots of people sick. As we gather tonight, we're in the midst of yet another wave of COVID-19. It's nothing like the surges that we suffered through the last 3 years, and this latest wave seems to have crested. But if I had to guess, I would guess that most of you either have had a bout of COVID fairly recently, or live or work or go to school, or have a friend or somebody who has had COVID fairly recently. I know I have. I got it for the first time, unfortunately, this summer, and I brought it home, and I infected my wife, which was not great for our marriage. My case was pretty mild, but my wife got quite sick and was, battling symptoms for months. So, even for people who don't end up in the hospital, it still can have a big impact on their lives. We know about businesses that have been struggling to stay open because so many people have fallen ill. We know some schools have even had to close because so many staff have been out sick. Some schools have even reimposed mask mandates. And so hundreds of people are still getting so sick and that they're ending up in the hospital and are dying each week. Hundreds of people are still getting so sick and are dying in this country today. And, most of them are quite old and they have other health problems, or maybe they're not vaccinated. But nevertheless, COVID remains a leading cause of death in the United States today, and will continue to be so for the foreseeable future. And another wave is probably coming at us over the next winter. So COVID and the pandemic are still very much with us. But, it didn't have to be that as bad as it was. We have what I think can reasonably be described as, and I don't think it's hyperbolic to say, medical miracles, the vaccines. When Operation Warp Speed was announced, I rolled my eyes, even, not just because of the Star Trek reference. The idea that a federal program would be able to produce an effective vaccine quickly enough to really make a difference, I just thought it was impossible. Something like that had simply never happened. Think about AIDS. How many decades have scientists been laboring to develop an effective vaccine for HIV? But a confluence of factors, most notably the maturation of the mRNA technology, miraculously made it happen, giving us not one but 3 highly effective, very safe vaccines. And billions of people around the world have taken advantage of the vaccines, saving millions of lives. But 1/3 of those eligible for the original primary series of vaccines in the U.S. never got the shots. Only 17%, 1 out of every 6 people who were eligible, got the last booster. And I think most shockingly, only 43% of those most likely to die from COVID, people aged 65 and older, got that booster. Less than half. In short, that's the big reason why more than 1.1 million people have died from COVID in the U.S. and why this country was hit so hard, and why so many people are still ending up in the hospital and dying every day today. Now, we'll have to see how many people roll up their sleeves to get the newest vaccines that have just arrived. Even though there's been a burst of interest at the start of it, I'm not that optimistic that many people will end up getting the latest iteration of the vaccines. I just, the sense of urgency about the pandemic is over. People aren't thinking about it. But, it's kind of mind-boggling to me that there's been this incredibly powerful weapon available and people just aren't taking advantage of it. So what's it been like, on the front lines of covering this pandemic for NPR through all this? To be honest, it's been incredibly depressing and dispiriting, really, to say the least. And it prompted a lot of soul searching on my part, and I think a lot of my colleagues, about our career choice. I went into journalism because I believed in this whole notion that, a free press was fundamental to a democratic society, and that accurate, reliable information could truly make people's lives better and really make a difference and help keep people safe, especially during a crisis like a global pandemic. And, actually change people's minds, convince them of what the right path might be. And for 3 years, I was cloistered in my attic, broadcasting almost daily alarm bells about this devastation of sickness and death and despair that was approaching, only to see those warnings repeatedly basically ignored and dwarfed as the toll of the virus mounted as the months and the years went on. I felt like I was kind of screaming into the wind and nobody was listening to me. Maybe it was because I was in my attic all by myself and I couldn't really tell if anybody was listening. But I have to admit, it was kind of shocking, and not only because I felt like my work wasn't really having the impact I hoped it might, but also because, I grew up believing in the power of, medicine and awed by, the world-changing victories that we've seen in public health. We beat back some of the world's worst scourges, smallpox, malaria, polio, and that was won by a vaccine, that had gone down in history as one of humanity's greatest achievements. And I'd also grown up, thinking that the pronouncement by government health authorities, like the Surgeon General, when people like that spoke, people listened, and it could change people's minds and changed entrenched behaviors in people. I mean, think about even sensitive subjects like AIDS and things like smoking and seatbelts and drunken driving. The government authorities and changes in government policy, it did change people's behaviors for the better and saved lives. But and I'd spent decades as a science journalist doing story after story about the inevitability of another pandemic, and chronicling how the U.S. and the international global community had been prepared for outbreaks of infectious diseases. I'd covered AIDS and the AIDS pandemic, the swine flu, the bird flu, Ebola, the first SARS outbreak, Zika, and I'd seen up close how national and international public health could leap to action and defend against emerging pathogens. It was never perfect, far from it, but by and large there was widespread public support for public health during these frightening encounters. And I assumed that would happen again, and that the U.S., with its robust public health system and the world-renowned Centers for Disease Control and Prevention, would muster one of the most effective responses. I wasn't naive. I knew my history. I knew that, masks had triggered protests and resistance and even violence during the 1918-1919 Spanish flu, and quarantines that were aimed at controlling cholera had triggered riots, and hesitancy to take advantage of common childhood vaccines for diseases like measles had been on the rise for years in the U.S. But I naively thought that when the big one hit, that long-feared pandemic actually finally arrived, the clear and present danger and threat that it posed would overcome all that and kind of unite the country. It's sort of like wars unite nations. But as we know, not so much. In fact, the opposite happened. Instead of uniting the country, the pandemic and the public health response to the pandemic had the opposite impact in many ways. It deepened divisions and it intensified the political polarization that was already in place in this country. Masks became political symbols. Vaccines became villains. School closings left bitter wounds. Things like social distancing and treatments all became flashpoints for conflict. And similarly, one would have thought that something as dramatic and devastating as a deadly pandemic would have rallied support for the CDC and the nation's public health system writ large, which had long been both highly respected and badly neglected. And the pandemic exposed huge shortcomings and vulnerabilities in our antiquated, disorganized, fragmented public health system. Instead of a renewed recognition of the importance of a strong public health system to defend the nation against diseases, and an infusion of, much needed political support and funding, again, the opposite happened. Our public health system has been left weaker by the pandemic, which is, I just find mind-boggling. And let me talk, when I say that, there are very practical and specific ways it's been made weaker. You know, overworked, underpaid public health workers have been vilified and harassed in this country just for doing their jobs of trying to protect the public and public health. There's a study by researchers at the Johns Hopkins Bloomberg School of Public Health identified 1,500 reports of harassment across local health departments in the U.S. during the first 11 months of the pandemic. And the study found that more than half of surveyed local public health departments, 57%, had been targets of harassment. 222 state and local public health officials left their positions during this time period, and more than 1/3 of those departures involved officials who had experienced some form of harassment. And overall, public health employment in the U.S. shrank by half in 5 years, according to one estimate. And that's not all. The public health powers of state governments have been restricted throughout the country. At least 30 states have passed laws since 2020 that limit public health authorities. Health officials and governors in more than half the country are now restricted from issuing mask mandates, ordering school closings, and imposing other protective measures, or must seek permission from their state legislatures before renewing emergency orders. The Alabama legislature barred businesses from requiring proof of COVID vaccination. Here in Tennessee, officials now are barred from closing churches during a state of emergency. Florida made it illegal for schools to require coronavirus vaccinations. And in fact, the governor and the Surgeon General there recently warned people younger than 65 against getting the newest shots. And instead of boosting funding for the CDC, Congress recently cut it. And all this leaves the country, I think, hobbled if it ever has to respond to the next crisis. I mean, think about it. What will happen if SARS-CoV-2 suddenly evolves into an even more dangerous variant, or the long-feared bird flu pandemic actually arrives, or yet another entirely new pathogen emerges? Can you imagine anyone trying to impose new mask mandates or vaccine mandates or quarantines that would be necessary to contain that? Will old infectious diseases we long thought were under control, like malaria, polio, be allowed to resurge? And these are very real questions. I mean, especially as climate change and international travel and development are spreading known infectious diseases to new parts of the world and unleashing new emerging pathogens. The first indigenous cases of malaria in 20 years in the U.S. were recently detected in Florida, Texas, and Maryland. Polio has been spreading again in New York State. What's going to happen to childhood diseases like measles? You know, vaccine hesitancy for the childhood vaccines has already been rising, and there's some evidence that that's gotten worse because of all the anti-vaccine sentiment that was whipped up during the pandemic. So the obvious question is, why? Why did this happen? Well, you know, the obvious answer is the confluence of the pandemic arriving in the midst of this caustic political environment that we're in. The nation was already bitterly divided in many ways, but I think it was more than that. Just distrust of many of our most prominent institution and authority figures has been rising in general for years in this country. And of course, that included scientists and doctors and government scientific agencies and officials. And I think it's kind of a manifestation of broader social trends, including this sort of, the backlash against globalism and this perceived elitism among intellectuals. Rising, increased income inequality has fueled a kind of a growing sentiment that the powerful in authority just don't care about the average person and can't be trusted. So the pandemic arrived at that moment, and it just exploded and exacerbated all of those problems that have been kind of simmering in society for a long time. It was also the first major pandemic of the internet age. On the one hand, that made it much easier for scientists to communicate with each other and with the public, instead of following the traditional path of waiting weeks or months to reveal their latest scientific findings through carefully reviewed, peer-reviewed reports in respected journals. Scientists were essentially releasing the results instantaneously by doing things like posting their papers on preprint servers. We saw science happening in real time in an unprecedented way I'd never seen before in all the years I've been covering science. And this was absolutely the right thing to do to respond to a fast-moving crisis. But suddenly, a flood of scientific data was unleashed on the public and on science journalists like me. And some of it was correct, but a lot of it, not so much. It was just plain wrong. And that, I think, contributed to this whole feeling, a sense of confusion and deepening the notion that science just didn't know what it was doing. So why should we listen to what these people are saying? They don't know what they're doing, even though they were doing their best under the circumstances. And at the same time, misinformation spread instantaneously because of the internet in a way that had never occurred before. And it was fueled by, some politicians who opposed mask mandates and vaccines and other measures. And that just deepened and hardened, I think, the distrust and outright hostility towards scientific authorities. And the reality was that science had very little really reliable information to counter that tsunami of misinformation. I mean, this was a new virus that had suddenly mutated in an unexpected way and was continuing to evolve in ways that shocked scientists and we had never really seen before in modern times. Did it spread through the air, by touching each other, by our mail, by our groceries, by our dogs, by walking past it? Do you remember? I remember people thinking, is it okay to walk on the bike path when a jogger runs by? Will I catch the virus that way? I mean, nobody knew, really. We didn't know. NPR, to try to deal with all of this, we started a nightly show called The National Conversation. And every night, me and my colleagues would try to answer, the flood of questions people had how to stay safe and protect themselves and their family members. And I was literally emailing trusted sources in real time at night on the radio trying to get answers to questions like these. And many, would email back with certainty. No, don't worry about petting your dog. And yes, the virus, it definitely lingers on surfaces, so wipe down everything with alcohol. And then we now know that a lot of that advice was wrong. I mean, the wiping down everything with alcohol, the dog part, that was fine. I don't think anybody caught COVID from their dog. But to make matters worse, our government authorities committed one unforced error after another. Official advice was often slow, it was confusing, it was contradictory, it was constantly changing, it was often just plain wrong. Don't wear a mask. Yes, wear a mask. Make your own mask. Oh, wait. Only use an N95 mask. Wait. You can use a KN95 mask too. Surgical masks, they work great. No, they're too loose. The virus, it doesn't spread through the air. Wait, yes it can. But, so stand 6 feet away from everybody else and you'll be fine. But wait. The virus can travel even farther. Close schools, don't keep them open. I mean, do you blame people for just kind of throwing up their hands at some point and saying, they don't know what they're talking about, so I'm going to stop listening. And the reality was, suddenly the public and science journalists couldn't even trust the information coming from our own government, the head of the CDC, the FDA, Health and Human Services Department, the White House. And that included the most basic information, like how many people were getting infected, where, how many people were getting vaccinated, how many people should get vaccinated. So what happened was, academic researchers and many journalistic organizations stepped into the void. The Atlantic's COVID Tracking Project and the Johns Hopkins Coronavirus Resource Center and the New York Times website, they became the main sources of reliable data for the public and even public health experts and epidemiologists and policymakers, and as they were trying to respond to the pandemic. At NPR, we teamed up with researchers at Harvard and Brown to produce a series of reports analyzing vaccination rates because nobody else was doing this. And we realized, state governments didn't know exactly what they were supposed to do. And some state officials relied on these reports to guide their vaccine policies and campaigns because the official government sources were no longer, we had to fill that void, basically. And supposedly revered government authorities like the CDC, they stumbled catastrophically at the beginning of the pandemic with the testing fiasco, and they simply never recovered. The CDC was hidebound, we realize now, by antiquated procedures that were too much like academic institutions. And we're not nearly enough like a quick response SWAT team that it really needed to be to respond to such a crisis. And to this day, the CDC's guidance remains painfully slow, and it's still often unclear and misleading. I mean, they can't even get their mask guidelines right today. There's a big debate. Should people wear surgical masks or shouldn't they wear surgical masks? And the answer seems pretty clear that no, they really don't do a good job, but the CDC can't figure out what to do, and so it hasn't said anything. And I mean, like, how many people in this room, do you know what to do if somebody in your household tests positive for COVID? I mean, do you know how long you're supposed to stay home? Do you know how long should you wear a mask? For how long? Should you get tested? How often? I'm not even sure, and I do this for a living. So it's kind of astounding that we're still in that kind of place. So the question then becomes, where do we go from here? Well, I think the pandemic has changed journalism, and specifically science journalism, probably forever. I can't imagine we're ever going to go back to the days when scientific findings were essentially withheld from the public until a small club of editors at prestigious journals like the New England Journal of Medicine and Science and Nature decide it's ready. Preprint servers and even Twitter, which I guess now is X, have become invaluable tools for science journalists like me. I used to get a lot of my stories from, the embargoed advanced materials that would be sent out by the journals. It's a system that I long supported because it gave science journalists invaluable time to vet scientific research and gather necessary context. But nowadays we learn a lot about new research instead from those preprint servers and from tweets from trusted scientists. And in many ways, that's a good thing. The public learns about advances much more quickly. It's democratized science in a good way and science communication. But it also means that science journalists like me have to kind of double down on our own efforts to quickly vet, validate, and contextualize findings before reporting them. In other words, the onus on us has never been greater. The pandemic also elevated, I think, the visibility of science journalists who had, I think, before then kind of been considered kind of like geeks talking to geeks about geeky stuff that only geeks really cared about, right? And the pandemic kind of reminded us that how important it is and literally life-saving it can be for journalism writ large to have journalists who are skilled at understanding complex scientific information quickly and translating it for the public. I'm always surprised when I'm reminded that even many doctors get their information from the media. I was just had my annual physical a few weeks ago, and my doctor was like quoting back a story that I'd done. And I was like, wait a minute, you sure about that? But the sad reality is that the number of dedicated science journalists at work today in the U.S. has fallen dramatically as newsrooms around the country have slashed their staffs, and we have to rebuild that too, I think, although I'm not really optimistic about that either, given the sorry state of the news industry, especially in many places, local news. Okay, now all that said, I do think the pandemic has taught us some valuable lessons that I think we can try to use to kind of rebuild things. Okay, and here's one. We have to be brutally honest about what we know and what we don't know. And I think that what we think we know today may very well change tomorrow. Science and scientists, and I think public health authorities, often make the mistake, and I think they made it repeatedly throughout the pandemic, of thinking that they need to boil everything down to a very simple message, or else people won't listen or won't understand it. And I think that creates the false impression that science can know things absolutely. Yes, we can know some things with certainty, like, okay, cigarette smoking causes cancer, but that only came after years, if not decades, of careful scientific research. Let's take the vaccines as an example. Remember when they first came out and everybody was saying, oh, they're 95% effective, right? Well, they were that effective at reducing the risk of symptomatic COVID in the trials that were done by the drug companies. But the message was so oversimplified for the public that I think everyone thought they were like some kind of magic impenetrable shield that would protect you from even catching the virus. So everybody was kind of shocked and terrified when so-called breakthrough infections started happening. You remember that? And the reality was Nobody ever expected the vaccines would prevent all infections. That was impossible from the get-go. But that was lost in the messaging. And I think that kind of permanently undermined the confidence in the vaccines. And we're still, suffering the consequences of that today. So what we have to do as, I think, science journalists and I think government officials is make it clear that science is a process. It can only rarely make simple statements that withstand the test of time. We have to take people along for the scientific discovery ride. We can't go too deep into the weeds so that we lose people, but we can't underestimate people's ability to absorb enough information to understand and trust what we're telling them. I think the three most important words are, we don't know right now. This is what we think is the case, but it could change tomorrow. Three other good words are, I was wrong. What's what we thought at the time, that has changed. We've learned now more, and now we think this is the case. I think that's the only way, or one important way anyway, that we can start to rebuild people's trust, is just to be more honest with people, more transparent about the way science works and the way journalism works and the way policies are made. Here's another, I think, important lesson. Repeat, repeat, repeat. Let me repeat that. Repeat, repeat, repeat. The old line is, repeat a lie often enough and it becomes the truth. So that's how misinformation wins, right? But I think there's a chance that repeating the truth often enough can also win out. I have to hope that's the case. And that doesn't, though, come naturally to journalists, right? I mean, we're all about telling people something new, the news, right? Not repeating what we've already said or know. And I think we have to kind of retrain ourselves to get comfortable with repetition or find creative ways and engaging ways to repeat the same thing in new ways, like telling people the same story through a different lens, through the eyes of, say, a patient and then a scientist and then maybe a public health worker or a nurse and a doctor on the front line. Find ways to make it engaging to get the information across. And here's another one. Science isn't apolitical, especially when it comes to public health. It's not just based on hard analytical scientific data, which I think is another mistake. Is sort of people have this idea there's a bright line between the science sort of stands above politics, apart, and that's not the case, especially when it comes to public health, because other things like psychology and sociology and politics and people's individual values all come into play when it comes to public health. Even if we agree on the data, we may value different priorities. And so I think science and science journalists have to stop perpetuating that myth that somehow science is above politics, that can produce simple, indisputable truths. But the real truth is that's just not true. Almost everything can be seen through a lens, and we have to acknowledge that. We have to acknowledge that to become trustworthy again. We also have to give up this notion of false equivalency. The journalistic default mode is the old he said, she said formula where both sides of an argument are given equal time. That just doesn't work. And in fact, it's destructive when it comes to assertions based on misinformation. No, the mRNA vaccines can't reprogram your genes. No, the vaccines have not only been tested in mice. No, they haven't caused thousands of deaths more than COVID itself. No, ivermectin can't treat COVID. No, COVID is not just like the flu. We have to call a lie a lie. There was this huge debate that went on in newsrooms around the country about whether to use that word, a lie. And I think finally we've come to the conclusion that we have to be direct about it. When we know something is untrue, we can't beat around the bush. We can't use euphemisms. We have to say, no, that's just plain wrong. In the same way we have to say what we don't know, we have to say what we do know. And there are certain things we do know, and we have to have confidence to say it. Journalists also need to diversify our sources, and I am as much guilty of this as anybody else. Too often we go back to the same kind of cast of experts from elite academic institutions, and that just kind of reinforces the idea that scientists are these kind of remote eggheads in some distant ivory towers who are out of touch with the lives of ordinary Americans. We need more voices and faces from scientists and researchers that look and sound more like America, again, to help rebuild trust. Another thing I think we need to do is we have to look at information not only from the supply side, where it's and who it's coming from, but also from the demand side. And what I mean by that is, what are the questions that real people have and want answers to? And we can't be dismissive of those questions, regardless of how many times we as journalists think we've answered them, or we think the scientific establishment has answered them and they're settled questions and have been answered beyond a question of a doubt, or how misinformed we may think those questions may be. If people are wondering things, we have to take that seriously, and we have to answer them to resolve their hesitancy and their distrust. And we need answers in plain language that don't sound dismissive and condescending. I think that's a trap that I think government officials and scientific authorities and journalists fall into way too often. So at NPR, we are trying to do things a little differently. One example is we're trying to provide kind of hardcore news you can use interpretations of major news developments more quickly across all of our platforms. For example, here's an example. When the new vaccines were recently approved, we did the usual coverage explaining kind of the basics, on our radio, news magazines, Morning Edition, All Things Considered. But we also prepared a detailed online story answering all of the practical questions we thought people would have that we posted on our website the morning the new shots won the CDC's official endorsement. We also immediately published audio versions of that on two of our podcasts, Life Kit and Shortwave, to try to meet people where they are. Find the audience where they are and respond to the real questions that people would have. And not just assume that everybody would just say, okay, new vaccine, we're going to get it. Everybody should get it, so they'll get it. And they're not going to get it. Now, will any of this work in our current environment? Honestly, I don't really know. I have to hope that it can, or I just give up, right? But so many of us live in such isolated, limited echo chambers of information. I'm not sure. It's harder than ever to reach people because the way we get our news and our information is so segmented and fragmented now. But I sure hope that it does, because we've got a lot of big problems, right? I mean, like simple ones, like just keeping ourselves alive. Think about it. In this country, after decades of progress, life expectancy in the U.S., which has long been considered a singular benchmark of a nation's success, it peaked in 2014 at 78.9 years. It's been drifting down ever since then, and that started before the pandemic. Life expectancy dropped for an unprecedented second year in a row in 2021, while other countries all around the world, like the UK, Switzerland, Japan, saw their life expectancies rebound during the second year of the pandemic after the vaccines arrived. The U.S. did not, and it's continuing to fall farther and farther behind. Americans are dying at younger ages than their counterparts in all the other wealthy nations. How could this happen in a country that prides itself on scientific excellence and innovation and spends an incredible amount of money on healthcare? The population keeps dying younger and younger. Why? Well, it's a combination of factors, poor diet, things we've all heard about, our sedentary lifestyles, our epidemic of obesity, all that stuff. But that's not all. There's something else going on here. I'm not sure what it is. Great minds of our country haven't figured it out. But it probably has to do with, a combination of social factors like poverty and inequality in our physical environment, our policies, our values. And I haven't even mentioned the epidemic of deaths of despair, drug overdoses and alcoholism, suicides. They all are rising. And there's the horrific epidemic of gun violence. Now, some of my colleagues have reacted to all this by trying to focus on doing stories about solutions instead of problems, which I think is a smart approach. And Part of it, I think, is for them to stay sane. And part of it, I think, is doing a real service, give people a sense of hope about how to eat healthier and reduce stress and exercise more and develop and nurture relationships with friends and family, all things that can help reduce the risk of some of the biggest lifestyle diseases like obesity and heart disease and cancer. I am still keeping an eye on the pandemic and cover it when I need to, but I've increasingly started to return to focusing on areas that I was covering before the pandemic, which were cutting-edge biomedical technologies like gene editing and synthetic biology and stem cells. I've always been attracted to stories like that because they allow me to explore the intersection of science and health and ethics and social trends and all the complicated and nuanced questions that they raise. So I'm used to science and politics mixing. But now I approach it not just as kind of like an intellectual challenge like I used to. I know now in a much deeper way that if we don't figure out how to resolve, a better way to resolve our disagreements in the public square when it comes to technologies like this and all issues related to science and technology, that it can have dire impacts. I mean, these new technologies that I've been covering, like gene editing techniques like CRISPR, they hold enormous potential for curing diseases, from diabetes and Alzheimer's to cancer and heart disease. Scientists are developing a new kind of reproductive technology that I've been exploring recently called in vitro gametogenesis, or IVG. It could revolutionize the way humans reproduce and help prevent miscarriages and birth defects and treat infertility. But all these technologies, they are extremely controversial and raise a long list of really, really tough ethical, moral, and societal issues. When does life begin? How do we define life? How are we ever going to agree on how to use these technologies and where to draw the line on how and when we should use these technologies if we can't even agree that it's a good idea to wear a mask to protect grandma from a new kind of pneumonia, right? But we have to figure out a way to negotiate these things. If for no other reason than what we saw happen this summer. I mean, think about it. Because of climate change, our world was literally on fire. Where I live in Washington, D.C., people were wearing masks outside again, not because of COVID, but because of smoke from Canadian wildfires made the air outside unhealthy to breathe. My neighbors were getting sick just from going for a run. My son's camp was canceled because it was too dangerous for the kids to be outside. And we all know about what happened in Maui, right? So how in the world are we going to save the planet from climate change if we can't even agree that vaccinating our kids with a safe vaccine can protect them from a deadly virus? So we have to figure out a way to do it. And I'm going to end on that cheerful note. And thanks for sticking with me. And if anybody still isn't too depressed by that dreary talk and wants to ask me any questions, I'll be happy to answer any questions.
Thank you very much for your wonderful lecture. What do you say to people who don't believe in climate change? Because there's a lot of them out there.
Luckily, I don't cover climate change, so I don't have to engage in that often. But, I mean, I don't know about you, but I think it's becoming increasingly hard to ignore. You can just see it in your daily life. And that's every day we're seeing more and more evidence of it. I think I can see how people can still argue about how much what humanity is doing is contributing to it and what the right response to it is. That is a perfectly legitimate debate, but there's no question that it's happening and it's having a real effect on our daily lives. Again, that's an area that we have to figure out how to get our political system to work to address it, and that's the main question. Not so much is it happening, but what is the smartest way to address it? People have it. It's interesting. I think the climate change debate is similar in a lot of ways to the pandemic debate because it's balancing like people's immediate needs. Keeping businesses open, people keeping their jobs, right? That's keeping kids in school against the long-term effect of these things. And I don't know. We have to figure out a way to find some middle ground to find a solution. I don't know what it is.
Hi. Welcome from UMass.
Oh, great.
There's some Massachusetts people here.
Excellent.
Yeah. Right before I retired, I worked in Japan and lived in Japan a lot. Worked for the U.S. military. But I just happened to be there when the tsunami happened.
Oh, wow.
3 miles away, so I'm lucky to be alive.
Wow.
But to look at that country and the way they handled it, and then to come back to the U.S. and see how things fell apart, it's been difficult. It really has been. When we had to send a lot of Americans, family members of the military, home, according to Japan. I mean, that was on the list. It was like opening a book and, okay, chapter 1 says that Japan is doing this, Japan is doing that, and the whole thing was taken care of. And then to be here during the pandemic, just what you spoke about, that the government, the health department knows what to do, but the government is saying, well, we don't know about that, so let's think about it for a while. It's very upsetting.
Yeah. Thank you.
Hi, so I had a question about, so I know you were talking about the messaging and changing the messaging, and that was one thing I kept thinking about during the pandemic as someone who works at the university and understands how research works, and then with my partner who's also a researcher, and then he would call his family and they would just start spouting out these lies, right? So I guess my question is, do you have a story from your experience where you first realized, wait, I have to talk about this differently? The way I'm talking about this isn't happening or isn't working. Did you have those moments? Because I'm also thinking about, watching Anthony Fauci on TV. You could see how he started to change a little bit the way he was trying to communicate information. So I wonder if it was a similar process for you.
Yeah, I guess it was a combination of big and small, kind of like seeing what was happening in the country, and also my personal interactions. I had similar experience like your partner did, where, I would understand things in a certain way, and then I would talk to people and realize that they were understanding it completely differently, right? And I realized what I was up against, basically. And I don't think I ever figured out a way to fix it, honestly. I kept trying to find ways to say things in different ways that could kind of cut through all the noise, and tried to, do some of the things I talked about by getting different voices to express these things. But it's hard because, like I said, most of the people who were hearing something completely different because they were getting their news and their information from a completely different source. They weren't listening to NPR, right? I would have thought that, I think one of the most shocking things to me was when I thought that even if people didn't believe what they heard on NPR, or didn't believe what, an authority figure would say, they would believe people they know and love, like their own family members, right? I had a friend who, was a doctor and had relatives, in Ohio, and would go home and couldn't get through to his own people who, grew up with him and loved him, and, so, yeah, that kind of floored me, honestly, and if that is, so it's hard to know what really works, but I can only hope that if people have enough of those interactions on a personal level, on a personal, the trusted messenger, it will eventually work. I don't know. I hope so.
This is a hypothetical, but suppose that a new variant came along or a new pathogen came along that put us back to March 2020. Who are the first 3 people you're going to call?
I would probably, first three people I would call would be virologists. There's a handful of virologists that I've gotten to know over the last 4 years who this is all they've been doing now, and who I found were, what's the term? Scarians. They were like the opponents of scarians. They were very level-headed and even-keeled and did not freak out every time a new variant came along, and did not contribute to this scariant, idea where every new variant was like a coming apocalypse. So that's where I would start. To really know the genetics and the virology can really help me understand just how much of a threat they pose. Like there was the most recent one of these was this BA. There was a 286 variant that for a while people were really freaking out about because it had mutated as much as Omicron had mutated, and a lot of people were saying this is the next Omicron. Turned out not to be the case, and that's what I was hearing from these folks. So that's probably where it'd start.
I wanted to ask you a little bit about misinformation. You touched on it a bit. I can remember when I was growing up, beginning to understand that even though we had great new technologies coming out every few years, that most of them eventually would have some downside. But when the internet became sort of widely available in the 90s, it was hard for me to imagine there was any downside. The notion of everybody in the world being able to have access to all the information and learning from that. And there were a lot of good benefits that came from that. But as time has come on, and especially during the pandemic, I think this idea of misinformation kind of overtaking the information flow and why that happened and what could be done to sort of counter that, at least on a large scale. I wonder if you have more thoughts about that. I'd appreciate hearing about it.
Yeah, no, I had the exact same experience. At first, it's how could you think there would be a downside to democratizing information and giving people access? And suddenly, the world was available to everyone. But I totally agree. I think first of all, it's destroyed journalism. So on a professional level, it had a terrible impact. It's enabled us to reach a lot more people, but as a business, journalism has really suffered. I think I keep hoping there's going to be a shakeout at some point, and that meaning that there'll be a certain number of outlets of information that people will establish themselves with enough authority and independence that people will trust them, and won't. I think a lot of the reason why people go to these other sources of information is they don't trust a lot of the conventional sources of information, and they feel like they need to go someplace else. So I keep hoping, and I feel like it is happening to some degree, that some of the news organizations are starting to establish themselves as trustworthy to everyone, and not just from a political point of view. Hopefully that'll happen with time. I think that's happened with other new media in the past, that it's taken time for for things to shake out and sort of sort themselves out, and people to sort of figure out how to navigate them in a way that works better. And I keep hoping that's going to happen. So I got to keep hoping it's going to happen.
Hi, thank you very much for your
Sure.
talk. I appreciate it. So as you're speaking, I see the seal of the University of Tennessee behind you. And we are a land grant institution, and our mission is to make lives and lives better for East Tennesseans. And so as a science journalist, what advice do you have for academics who are experts in their field on how to communicate the value of their science to our communities? And secondary, how do you work with academics to provide the access for sharing that science?
Yeah, well, I am, always amazed at how generous researchers and academics are with, and how patient they are with people like me who call them up and and basically ask them to give a one-on-one tutorial on whatever they're working on. I mean, it's what enables me to do my job, and I know how busy everybody is, so I'm continually, appreciative of it. But it's not the case with everybody. I mean, not all researchers and academics are willing to take the time to talk to journalists. And also, we were talking earlier about how I have found a lot of scientists in particular, academics in general, and scientists in particular, don't know how to really talk to regular folks, and it's understandable. I get it. Every field has their own jargon and, in impenetrable way of talking to each other. It's just, it's a shorthand that you have to develop in order to do your jobs. We do it in journalism, and it's often really hard to get scientists to sort of rejigger their brains, in a way to be able to talk in regular folks in ways they can understand. But I have found that over time, I feel like scientists and researchers generally have come to appreciate that more and understand that more than they used to. When I first started, a lot of academics, a lot of researchers, a lot of scientists didn't want to talk to journalists, didn't think that was important, didn't know how to do it. And I think something happened where people realized that it was important, hadn't realized how important it was, and it's gotten better. We still got more work to do, for sure. Yeah.
This is kind of a two-part question. When you get information, what process or method do you use to determine what's truth, what's fact? And is there a way you could explain that to a layperson when they're faced with new information? How do they determine whether that's misinformation or that's truth?
Yeah. So, I first start off by just trying to critique it myself. At this point, I've been reading scientific papers long enough that I can sort of, tell often quickly if something doesn't seem right. There's some basic stuff you can sort of figure out by looking at, how big a sample size was, whether there was some sort of inherent bias in the way the study was conducted. So that's sort of the first level, Also, do I know this researcher? Do I know, am I familiar with the research? Have I worked with them in the past? So I have a certain level of trust from the get-go or not, and then beyond that, I can then start to, pick apart some of the methodology of the research to try to see if I notice any problems or flaws. And then I rely on, I know enough researchers at this point that will help me, basically. And I kind of do my own kind of quickie peer review process where I will, if something looks good to me and I think seems important, that I want to report on it, but I want to backstop my own judgment, I will blast out a bunch of emails to a bunch of scientists that I know and trust, and I don't feel like have a point of view necessarily or a dog in that fight, because as we all know, scientists and researchers can be, as petty and political as anybody else. No, they can't. And so it is often hard though, because some of those the scientific community and the academic communities, it can be kind of a small community, and there's a lot of history among researchers themselves, and bitter, so you have to be careful that even the people you trust aren't coming at it with a point of view. But there are enough of them out there that I can rely on that even and are honest enough. Will tell me, look, I know this. This person used to be my, one of my postdocs. I worked for them for years. And they will disclose this and because they know me well enough at this point. But I do have to rely on that kind of network of help to try to, especially nowadays when stuff is happening so fast. I mean, the flood of information is just, it's unbelievable. It just feels like time is sped up. Everything is moving so much faster than it used to. It's crazy. And also that the time it takes to translate scientific findings into the real world is so much faster. I mean, as I mentioned, I cover CRISPR, this new gene editing technique, which is really new, and it was, it's something that when I first started would have taken decades before it would end up as a medical treatment. But the first CRISPR therapy is probably going to get approved by the end of the year for sickle cell disease, which is amazing. It's amazing how fast things are happening. So it has made it very exciting, but a lot harder in a lot of ways.
Rob, thank you so much for joining us. Another round of applause for NPR's Rob Stein. And thank you, everyone, for, again, making time out of your busy lives to join us here for the Hill Lecture Series. Thank you for being here. Safe travels home. And please, before you leave, do join us for some refreshments. And Rob is available here for informal conversation as well. Thank you all so much.
Thank you.